Good morning, good afternoon, bonjour, achadin, siku njema, bon dia, malin, wanagsan. I think I covered everyone. Welcome everyone to our event today on strengthening anesthesia and safety in surgery. And thank you for joining us. So now, without further ado, I think we'll go into what has brought us here today. And I will start with Dr. Betty. What was the impact of pulse oximetry becoming available in your country, both in terms of patient safety and for anesthesia providers?
D'accord, merci pour la question. Avant d'y répondre directement, je vais commencer par raconter une petite histoire que nous avons vécue. Il s'agissait d'une cure de hernie chez un enfant de 4 ans sans aucun antécédent pathologique connu. Chez nous, je vous disais tantôt qu'on n'avait pas beaucoup de médecins anesthésistes réanimateurs, donc les infirmiers sont habilités à pratiquer l'anesthésie tout seuls. Donc, en l'absence du médecin qui était occupé, j'étais occupée ailleurs. Et pensant bien faire, les infirmiers ont décidé donc de commencer l'induction chez cet enfant. Et j'arrive quelques minutes après du moins, et je trouve l'enfant complètement agité. Je l'avais vu en préopératoire. Il était calme, un enfant sage, je dirais. Et là, je le retrouve en salle complètement agité. En me regardant, je me dis, ça tranche avec l'agitation décrite lors de l'induction inhalatoire. Donc, je me dis, il y a forcément quelque chose qui ne va pas. Et j'ai l'intuition de regarder les gaz frais. Je me rends compte que l'oxygène n'avait pas été ouvert. Donc, l'enfant s'asphyxiait, raison pour laquelle il s'agitait. Il ne recevait à la limite que l'halogéné. Et donc, on a ouvert les gaz frais, commencé à l'oxygéner, tout est rentré dans l'ordre, mais on a été tellement sidérés que tout le long de l'intervention, après, personne n'osait parler. Parce qu'on a réalisé la gravité de la chose. On aurait pu perdre cet enfant banalement. Et si on avait eu un oxymètre de pouls, on se serait rendu compte de la désaturation et on aurait pu régler la situation. Je veux dire, tout le monde aurait pu détecter l'erreur et la corriger. Donc, pour répondre à la question, l'oxymétrie améliore la sécurité pour le patient. Il peut présenter des complications, mais avec l'oxymétrie, on va détecter les anomalies assez rapidement et pouvoir les corriger. Quel est l'impact pour le praticien? Ben là, ça évite de culpabiliser. Si on avait perdu cet enfant sur table, banalement comme ça, on aurait culpabilisé. Donc, d'avoir un oxymètre de pouls permet de travailler de manière sereine. On sait qu'il n'y a pas de risque zéro, mais on a les outils pour détecter les risques et pouvoir les prendre en charge précocement. Donc, c'est ce que je peux dire sur l'oxymétrie de pouls. Elle améliore la sécurité pour le patient et permet aux praticiens de travailler sans gros stress, parce que le stress aussi aura ses répercussions sur les praticiens que nous sommes. Voilà, en substance, ce que je peux dire par rapport à cette question.
So now I would like to turn to Zippy, Dr. Zipporah. She's popularly known as Zippy. Would you like to add any insights and maybe some experiences to this?
I think one of the greatest things pulse oximetry does is to give, like Betty says, give the anesthesia provider peace of mind. You know what you're doing. For a long time, when there was no pulse oximeter, the anesthesiologist or the anesthesia provider had to, most of the time, put their hand on the pulse to know whether you still have a patient or not. But what I think is more impactful is when we've done the training for pulse oximetry and people give stories about patients that they saved because they had a pulse oximeter who otherwise would not have been saved. And also the sad stories about patients they think that if they had had a pulse oximeter, maybe the outcome would have been different. I think for patient safety and anesthesia provision, the inclusion of pulse oximetry has made tremendous impact on the outcomes and the safety of anesthesia. And now I think it also gives us an indication as to why maybe now more people want to give anesthesia a chance as a career, as a profession, because you're doing something that is definite as opposed to before. And then also it gives the whole team an opportunity to see what is happening, because that sound of the pulse oximeter is audible to everybody in the room. And this makes sure that patient safety stops being the sole duty of the anesthesia provider whose heart is on the pulse and maybe they fell asleep, but everybody in the room can hear that sound. You can hear when desaturation is happening. And I think that is very, very key. I think we need to advocate for people to get pulse oximeters. And this is the whole purpose of this discussion here. Thank you, Mary.
Well, now we will turn to Susanna. In both your countries, Susanna and Reshma, just like mine, we've all experienced high surges of COVID-19 with severely ill patients. What would you say was the role that pulse oximetry played in caring for these ill patients with COVID-19 in your country? If we could start with Susanna.
Está bien, gracias. Si yo tuviera que resumirlo en una palabra, pues diría vital o diría indispensable. La verdad que la COVID-19 ha venido en El Salvador, al igual que en todos los países del mundo, a representar un giro terrible, un retroceso, porque ya, sobre todo en nuestros países con economías precarias, ha venido a volver más precaria esta economía, sobre todo para áreas como salud, aunque se han destinado mayores fondos para esta área en la mayoría de lugares, pero aún así siguen siendo insuficientes. Y el pulsoxímetro del que nosotros en El Salvador contamos desde hace muchos años, se volvieron también insuficientes, porque como todos sabemos, el principal problema dado por el COVID-19 pues es pulmonar. Todos sabemos ya con mucha amplitud sobre la agonía silente y sobre la hipoxia silente del paciente. Entonces es todavía más importante porque muchas veces vemos al paciente aparentemente bien y cuando ponemos el pulsoxímetro, oh sorpresa, está desaturando. Entonces, en general, fuera de COVID-19 y más en COVID-19, estar con un paciente sin pulsoxímetro es estar a ciegas, es como tener la luz de la habitación apagada y hacerlo, el monitoreo, como era, no sé en sus países, pero aquí en El Salvador, como era quizás hace 30 o 40 años, que uno tenía sus ojos para ver la coloración de los dedos del paciente, la coloración de los labios, y para ver cómo respiraba. Con eso contábamos nada más. Yo no vivía esa época, pero cuando yo entré a la anestesia, pues ya había monitoreo, aunque mucho más precario que ahora, pero eso cuentan los anales y en muchos lugares yo sé que así sigue siendo. Solo contamos con lo que ven nuestros ojos, si no es un aparato, sino al paciente. Y en COVID-19 esto se vuelve doblemente importante por lo que acabo de mencionar. Los pacientes, incluso en sus casas, han necesitado y siguen necesitando, actualmente estamos en la ola número 5 en mi país, siguen necesitando incluso en sus casas contar con un pulsoxímetro que les dé una idea de cómo se está manejando, cómo se está desarrollando la enfermedad, si va hacia la complicación o si no pasa un nivel. Y ahora toda la gente aquí en el país y creo que en todo el mundo ya habla, perdón, ya toda la gente aquí habla de cuánto satura, habla de cosas que antes solo los profesionales, los proveedores de anestesia sabíamos de saturación, ahora todo el mundo dice es que saturo 80, es que saturo 85. Entonces definitivamente si tuviera que resumirlo en una palabra es indispensable. Así ha sido en El Salvador.
Thank you very much. And briefly, Dr. Reshma, could you tell us what role pulse oximetry played in your country during COVID-19?
Yeah, thank you, Mary. So yes, COVID-19, we had several surges with severely ill patients. And till date, with the third wave going on in my country, we have had 40 million COVID positive patients with over 500,000 deaths. Now, it has definitely affected our country's economy and the healthcare system. Especially trying time was the second wave. The first wave was well managed by just introducing lockdowns, so we could kind of control it better. But the second wave, we had a lot of healthcare which was tested, because we had limited number of hospital beds available, resources were limited, and we had lots more positive patients. So at that time, pulse oximeter really helped us to first is to triage the patient, also for which patients which we could monitor at home. And most places, what hospitals were doing, what stable patients with no comorbidities, they could be monitored at home. If they could afford to buy a pulse oximeter, then it was great. Otherwise, many a times the hospital provided the pulse oximeter with the hope that they will give it back once they are cured. And the other use of pulse oximeter was at the hospital level, where once the patient got admitted for being COVID positive, there was a triage as to where the patient could be shifted. Again, the ICU beds that time were very few for the patients which we were getting into the hospitals. So again, where the patient could go. So did they need only the isolation beds, or they needed HDU beds where we were using high flow oxygen, or ventilated patients obviously were shifted to ICU. So we were using triage for the transfer of patients. And thirdly, we were also using in isolation beds or HDU to control the oxygen given by the saturation reading. So we were using that as a guide rather than doing repeated ABGs, arterial blood gases. So we were just monitoring the saturation, and we were bringing up or down the oxygen given to the patients. So that's what we were using, the pulse oximeter. And Livebox definitely made a lot of difference by donating over 300 pulse oximeters during COVID time, which were given to primary health centers and government hospitals which were deficient or didn't have pulse oximeter. I've been pretty lucky because I work as a tertiary care center, but these places definitely needed the pulse oximeter. So I thank Livebox for their support during this trying time. So they really helped us to fight the COVID pandemic. Thank you.
Thank you, Reshma. If nothing else, COVID-19 has helped us put out the word that pulse oximetry is very important. Everyone knows about pulse oximetry now. But I want to quickly move on to VP and ask, are there any remaining access barriers for pulse oximetry? And are there any strategies to address these?
Thank you, Mary. When we talk about barriers, we mainly are thinking about geographical, and that Livebox has addressed to quite some extent. I think before the pulse oximetry project started, there were many operating rooms that did not have pulse oximeters that now have. And when we listen to the donations for pulse oximeters during COVID, we know that that aspect is being addressed, but there's still a lot that needs to be done in terms of availing pulse oximeters to these areas. And in the other areas, like the post-operative, post-anesthesia care units or recovery rooms, depending on where you are, post-operative wards, in the sick children's ward, like kids with pneumonia and the like. So the gap is still there. So we will still say you need a lot more pulse oximeters to actually say that you have no gap. The other thing that deals with barrier is financial access. And I think a lot of money has been put by Lifebox, and I think people need to give money so that Lifebox and other organizations can actually get money to deliver this to where they're needed to be. Then we come to the other issue of acceptability and knowledge and attitude. We really need to do a lot of work so that it doesn't seem that we're giving pulse oximeters and they're not being used, so people don't know why we need them. And one of the strategies for this is education. And education has very many prongs. The WFSA, which is the World Federation of Societies of Anesthesiologists, has done a lot of education. Lifebox have a training material that goes with the pulse oximeters. And this makes people aware of their availability and improve their knowledge levels on the pulse oximeter and its uses, and in improving patient outcome and patient safety. The other strategy that has come is the enhancement of the National Surgical, Obstetric, and Anesthesia plans that has been passed. And because these ones are passing the use of monitoring, and especially pulse oximeter to these. Once these are implemented, we hope that the national governments will be able to allocate money to the acquisition, to the training, and patient safety and monitoring, where pulse oximetry has a very big role. The other thing that has been done is also short-term education strategies like the Safe PEDS, Safe OR, and they all have some aspects of training in pulse oximetry. I think with these strategies and the WFSA publishing standards and guidelines that most people are now trying to achieve, and a lot of the countries in LMICs will strive to achieve these standards as well in as much as possible. I think once we have the pulse oximeters and people are striving for these standards, and there is education that is going with the pulse oximeters, then a lot of the barriers will be addressed. But I think it is really, really important what Lifebox is doing and what this Safe Initiative with Smile Train is doing in making sure that there is access to the pulse oximeters. But a lot more needs to be done so that more pulse oximeters are available and more patients actually benefit from this technology. And nations must own with our guidance and our advocacy. The word is advocacy. We must advocate that people need pulse oximeters, not only in the OR, but also in the other areas that they need. Thank you.
I want to quickly go to Susanna and ask that we've seen in the press that there's some ongoing publications which highlight an issue in the accuracy of oximeter readings in patients with darker pigmentation. So, as an anesthesiologist with dark pigmentation, I'm excited to hear what should we as an anesthesia community be doing about this?
Sí, gracias. Creo que preocuparnos, aparte de preocuparnos, hay mucho que hacer. En efecto, hemos visto esas publicaciones que destacan esta preocupación. Yo puedo decir que como médico anestesiólogo, proveedor de anestesias, destaco sobre todo pues, la importancia fundamental de contar con una oximetría de pulso, con un pulsoxímetro, y que este sea confiable, lo más confiable posible, porque de eso depende en determinado momento la seguridad y al final la vida de mi paciente, o por lo menos su evolución, si esta es o no es satisfactoria. Entonces necesitamos datos precisos. Yo soy miembro de la junta directiva de Lifebox, que como ampliamente sabemos es una organización que, lo hemos dicho aquí, ha distribuido muchos pulsoxímetros, de hecho 32,000 oxímetros de pulso, si no me equivoco, para su uso en monitoreo en anestesia y en cuidados críticos. Esto yo recuerdo empezó por la sala de recuperación, si no me equivoco, ahí empezó la inquietud y se empezaron donando y pues actualmente se va por esa cantidad que es muy grande en los últimos 10 años. Este dispositivo ha sido usado pues ya durante una década, creo yo, o más, por proveedores sanitarios, no solo de anestesia, sino por otro tipo de proveedores sanitarios en todo el mundo, y ha sido probado también de forma independiente en el laboratorio de hipoxia de la Universidad de California de San Francisco, que es el principal laboratorio del mundo en pruebas de oximetría de pulso. Eso creo que nos da como un cierto margen de tranquilidad y de seguridad. Evidentemente, pues nos preocupan estas publicaciones en curso que documentan inexactitudes o faltas de precisión en la pulsoximetría, dependientes de los tonos de piel, en específico las pieles más oscuras de los pacientes. Al igual que pues todos los miembros de nuestro sector, nos preocupamos por eso. Sabemos que la FDA de Estados Unidos, por ejemplo, está revisando los protocolos de prueba que exigen a los pulsoxímetros para estos ser aprobados. Lifebox ha conseguido financiamiento, y esto es algo muy bueno, para llevar a cabo un estudio independiente con el fin de cuantificar el rendimiento de los oxímetros de pulso en los distintos tonos de piel y desarrollar soluciones de libre acceso para la precisión de los pulsoxímetros en todos los tonos de piel. Este trabajo se pondrá en marcha en los próximos meses y trabajaremos de manera muy transparente para mantener a todo el mundo informado sobre lo que se avance en esto a medida que se vaya dando, porque sí lo tomamos muy en serio. Nuestra prioridad es obviamente asegurar que los oxímetros sean lo más precisos posible para poder monitorizar, como decía antes, al paciente de la manera más fidedigna posible, ¿verdad? Esto como proveedores de anestesia en particular.
So now I'd like to go to VP. I understand that you've been working on the development of an affordable capnography device. This sounds very exciting because capnography is something that I can't work without right now. But if I go, a few kilometers outside of the city, a lot of the places in my country have never seen a capnograph. So could you please talk us through this work?
Thank you very much, Mary. Lifebox and SmileTrain have been designing or working to provide a capnography that is affordable. One of the things that we have come to realize is that when I talked about the WFSA standards and guidelines, capnography is listed as standard of care. Yet in many places in LMIC, including the country where I work, capnography is not available. And capnography is a bit more complicated than even pulse oximeter, but it's very, very useful, especially at induction of anesthesia, to make sure that the tube is in the right place, to make sure that if you have an issue and you're resuscitating, that your cardiac output is okay. But the main thing is to minimize airway events at the provision of anesthesia. So what Lifebox and SmileTrain have done is to come up with a project to see how can we make capnography, which we understand and appreciate is a very, very important monitor, affordable, available in an affordable manner to most of the providers, especially in LMICs. Like Mary says, most of us who work in the city and in big hospitals have capnography all the time, whereas many other places, and especially the places where even pulse oximeter is a problem, then having a capnograph is even a pipe dream. So what we have done is we have gone through a process of looking for a capnograph that is affordable, that Lifebox and SmileTrain together can work and distribute. Initially, maybe to SmileTrain partners because they're putting a lot of money there, but eventually to most of the providers in LMICs. And what we have done is gone through a whole process of identifying a monitor that is able to withstand and give accurate data and be useful for the anesthesia providers. Fortunately, the capnograph is mainly used in the OR. And one of the things that we have done is to look for a dual parameter monitor. So it does both the pulse oximeter and capnography. If we are able to roll out this in all the ORs, then it means that the available standalone pulse oximeters can then be dispatched to the post-anesthesia care unit, to the wards, and to all the other places that we have said that they need pulse oximeter that we don't have. So it is a very good work in progress. And of course, just like the pulse oximeter, we are developing with it training material so that as people receive their capnograph, then they also know the importance and they also know how to use it appropriately. So we address both the availability, but also the knowledge issues so that people can use capnograph well. I think this is a great initiative, and I'd like to thank Lifebox and SmileTrain, and I'm very happy to have been part of this process, because then it means that we are doing a lot to make anesthesia and surgery safe and to improve the outcome of our patients. Thank you very much. Watch this space for the devices. I think one of the most important things that we must do in terms of improving anesthesia services is to stop working in silos. The physicians and the non-physicians, we must work as one team. And I think we need to realize the importance of each one of us, make sure that we have good leadership, good training, and work as a team and stop working in silos, because that is where a lot of disharmony happens, and that impacts on patient safety in a lot of ways. So stop working in silos.
Thank you, Zippy.
So yeah, let me talk Somali or English. And yeah, as we know, the pulse oximeter is one of the vital monitor in the OR, and easily, and so you can't use an pulse oximeter unless you know how to use it. So I will say pulse oximeter is very important. We can't provide in anesthesia unless we don't have a pulse oximeter. So everyone, I will encourage you. There was live courses online on website for the Lifebox, and Lifebox is very easy to use it, and it really helps a lot. So I will encourage everyone to look that online, which is for free. You can get it anytime, anywhere. So please, I will encourage you just learning. And as an anesthesia group, a family, we need to work at the same side to reach to gap of the 5 billion people who have not having access and who was not getting at the safe anesthesia, which is not accessing with the safe surgery, to be fill the gap by 2030. Thank you.